Can cracking knuckles cause arthritis? Do cracking knuckles cause arthritis? Well, the idea that cracking your joints can cause arthritis is a common myth. However, there is no scientific evidence to support this belief. When you crack your knuckles or other joints, the sound you hear is actually produced by the sudden release of gas bubbles in the synovial fluid that surrounds the joint. Within each joint, there is synovial fluid, a thick, viscous liquid that lubricates and nourishes the joint structures. This fluid contains dissolved gases, such as oxygen, nitrogen, and carbon dioxide. When you stretch or manipulate the joint, the pressure within the joint capsule decreases. This decrease in pressure allows gases that are dissolved in the synovial fluid to form bubbles rapidly, a process known as cavitation. When these bubbles form and collapse, they create a popping or cracking sound. The exact mechanism behind the formation and collapse of these bubbles is still not fully understood, but it's believed to involve changes in pressure within the joint space. So, the popping sound is merely the result of gas bubbles forming and collapsing within the synovial fluid, and cracking your joints does not harm the bones, cartilage, or surrounding tissues. You may also find some people can easily crack their joints but some cannot. What is the reason behind that fact? The ability to crack joints varies among individuals and can depend on several factors, including joint anatomy, flexibility, and the presence of gas bubbles in the synovial fluid. Factor 1: Joint anatomy. The structure of your joints can influence your ability to crack them. Some people may have joints that are more prone to cracking due to differences in the shape or alignment of the bones. For example, individuals with loose joint capsules or hypermobile joints may find it easier to crack their joints. Factor 2: Flexibility. Flexibility and range of motion can also play a role in joint cracking. Joints that are frequently moved through their full range of motion may be more likely to crack. Individuals who regularly engage in activities that involve stretching or bending their joints may find it easier to crack them. Factor 3: Presence of gas bubbles. The ability to crack joints relies on the presence of gas bubbles in the synovial fluid. Some people may naturally have more gas dissolved in their synovial fluid, making it easier for them to crack their joints. Additionally, the formation and collapse of gas bubbles may be influenced by factors such as hydration, joint temperature, and joint lubrication. Factor 4: Habitual behavior. Habitual behavior can also affect your ability to crack joints. People who frequently crack their joints may develop a habit of doing so, which can make it easier for them to produce the cracking sound. Factor 5: Age. Joint cracking may become more common with age, as the tissues around the joints, such as ligaments and tendons, may lose elasticity over time. This can increase the likelihood of gas bubble formation and joint cracking. So, the ability to crack joints is a normal phenomenon and varies from person to person. While some individuals may find it easy to crack their joints, others may not experience joint cracking at all. Although cracking your joints may be annoying to some people, it is generally harmless. However, excessive or forceful joint manipulation could potentially lead to injury, so it's best to crack your joints in moderation. If you have concerns about joint health or experience pain or discomfort, it's a good idea to consult with a healthcare professional. Thanks for watching. If you liked the video, please hit the like button or subscribe button for more interesting topics.